Okay, Rebecca. Okay. So I have a patient of mine here, Sandra. She's 72 years of age. And last year, June, she was put on the waiting list for knee replacement. She has both knees are severely affected. Can you put her X-rays up to just take a shot of the X-ray so that people can see that? Do you have that? There you go. Okay, just put the APs up. And as you can see, on both insides of the knee, they are worn out. Okay, and she's been booked for a knee replacement. Anyway, the reason we are sitting here is that Sandra, since November of last year, has lost 20 kilos, and I want to ask her how her symptoms are going. Sandra, how are your knees going?
Well, they've been much improved.
So, if in June of last year you had 10 out of 10 pain in your knees, where are you sitting
I would have said 9.5.
Yeah?
Yeah.
And now?
And now I'd say 50.
50. So she's now sitting at 5 out of 10 as opposed to 9.5 out of 10 when she had the surgery. So what did you do and how did you lose weight?
I knew I had to, if I wanted a knee replacement, I had to lose weight. I was 137 kilo to start. And I had lost a little bit before I started doing anything. I was down to 134 because I started riding a bike. I ride an exercise bike. And then I knew if I wanted to have this knee done, I had to lose weight. So I went to my doctor. He gave me the name of a dietitian. I had a phone call with her. She said she didn't think she could help me because I needed to lose weight fast. I went online and I saw this lady's name and it was Back to Basics, and I thought, well, I'll give her a call. I've got nothing to lose. Gave her a call, went and had an interview with her. And I thought, yes, I can do what she's proposed. And here I am, 20 kilos later.
Okay, and that's from November in 3 months. So, as far as diet is concerned, what was the major component of your diet that you eliminated to lose weight?
Sugar and flour.
So this is sugars and carbohydrates. So anything that's white sugar, carbohydrate like rice, potato, and pasta and stuff.
Pasta.
You probably
Bread.
Okay.
Yeah.
The other thing was she said bike riding. So what sort of exercises did you do? Because you couldn't walk, I suppose. So therefore you did bike riding.
Yeah. Just stationary bike.
How many minutes a day?
Well, I was only doing I started off because I hadn't done anything. I started off doing 50 revolutions. Then I went to 100, then I went to 150, then I went to 200, 250, and I'm still only doing 400.
That's all right, okay.
Not every day, not every day.
As you can see, just because you can't walk, that doesn't mean you can't exercise. There's other non-weighted or non-impact exercises, things like swimming, cycling, and rowing are the three that are probably pretty good for patients who have arthritis and who can't walk. Now, if I said to you now, do you need your knee replaced now? What would you say?
I'd say I think I've got a bit more time up my sleeve.
So there you go. So here's a 72-year-old lady who was 137 kilos. You are now
117 this morning. Yeah.
117. Still probably quite a high BMI, but just the fact that she's lost 20 kilos, her symptoms have gone from probably, let's say 9.5 out of 10 to 5. So almost a 50% reduction in pain and symptoms. And she's enjoying life a lot more. She can walk, she can do stuff. So weight loss is important, and we can all make excuses, but here's a lady who's proven that can work, it does work, and she's avoiding herself a knee replacement, maybe a year or two, a few years.
And physio. Physio.
You did the physio as well.
Yeah.
Anything else you want to say to the viewers who are looking at this?
Going to the pool helps as well, because it's low impact.
Low impact. So
and that's not swimming because I can't swim.
Yeah.
That's just walking up and down the pool and just doing a few little leg exercises.
So the answer is stop making excuses, right?
Yeah.
Okay, thanks guys.